My name is Robert Lerrigo. I am a gastroenterologist, just graduated fellowship from Stanford, and I have a special interest in inflammatory bowel disease.
This question comes to us from one of our followers on social media, Nada. She asks, if I know that an IBD flare is coming, what should I do to prevent or minimize the impact of the relapse?
That's a tough question because it depends on what you mean by I know an IBD flare is coming. Some people feel that they start developing more abdominal pain and they feel that that's consistent with the prior times they developed a flare, and therefore they feel like that's a sign of a flare coming. Some people notice more blood in their stool or blood in their stool when they didn't have any, and that's a sign that the flare has arrived. Um, it's a tough question to answer. And again, I think all patients with IBD should realize that there isn't a great correlation between symptoms and how much inflammation there is in your colon. Um, Abdominal pain should be something that you address in clinic in any form, right? I mean, we as doctors don't ignore abdominal pain, regardless of whether it's caused by your IBD or something else, So I don't want you to think that, doctors are being dismissive of your abdominal pain, even if they don't think it's necessarily related to a flare. If you have a flare of your IBD, independent of where you have symptoms, then there are medicines that we can give to help reduce inflammation, and we should start thinking about, revamping your medicines to help reduce the risk of further flares. So if you were recently started on a new medication, for example, and you developed a flare just by being on that medication, but we have to ask ourselves as gastroenterologists, well, why did you develop symptoms? Is it because that medication isn't working? Is it because there's low levels of that medication in your bloodstream, and so we really haven't given it a shot? But taking a step back, it also really relies on ruling out other causes of the symptoms of flares. So there are many different causes of blood in the stool when people have flares, and one of them is infection. So people with IBD are at higher risk for developing C. diff infection, C. diff colitis, or Clostridium difficile is the name of the bacterium that causes it. So it's reasonable to make sure that patients don't have that infection going on that's the cause of their symptoms. So really the easy answer, the safe answer is talk to your gastroenterologist soon and early about what symptoms you're having, because they need to make sure that they rule out other causes, other diseases that can cause your flare that may be reversible. And if it is truly, and they also need to determine whether it is due to your IBD that is flaring. And then 3, if it is due to your IBD, they need to give you medicines to alter its course to help reduce the inflammation that's there.